I gotta say, if there's one line that's grating my ears more and more now as I hear it come from Canadian politicians, it's their continual go-to refrain of how they are taking the advice of public health officials. It's the line that they roll out whenever they bring in new restrictions, or whether they continue lockdowns after they were supposed to end, or they say, oh no, that 28-day period, it's actually not coming to an end, we're going to renew it for another period. Those times when they always roll out that line as their sort of excuse. This is why we are doing this, and one may not question that. And I imagine I'm not the only one who feels some frustration at that go-to line of theirs, in part because I want to know, what does it mean? What do you mean when you just say, we're taking the advice of our medical officials? Now, I think most of us are smart enough to have clued into the fact that it's kind of their insurance claim if things go awry. They, oh, well, it wasn't me. I didn't come up with this. I know I'm the premier, the mayor, what have you, but I'm not responsible. It's those guys. It's the medical officers. They're responsible. I imagine there's a bit of a liability component to it as well. But I also wonder, to what degree are they just taking this advice, hook, line, and sinker, and not pushing back, not asking critical questions, not asking follow-up questions, or even at some point saying, look, thank you very much for your presentation and your assessment and your game plan for what we should do, but just so you know, we're not going to totally shut down retail outlets. We're going to, we're going to take the Canadian Federation of Independent Businesses very modest request that says small retailers can stay open to 3 customers at a time, no more than 3, and we're going to make that work. So that's what we're going to do, and please, public health official, take what I've just said right now and then go work out a game plan for that to happen. Has there ever been a time like that where our elected representatives are actually managing the officials as opposed to those officials, the public servants, managing the politicians? Because it sure seems like the latter is taking place. I spoke recently to Lieutenant Colonel David Redmond, retired from the Canadian Forces, and after his time in the forces, he ran Alberta's Emergency Management Office a number of years ago. And he talked about how the original game plan is not for the public health official to become the person basically in charge of everything during the time of a pandemic. They play an important role for sure, but they're sort of one part of all that, one spoke in the wheel, because there's so many other factors that need to be taken into consideration. And then there's a leadership person, emergency management official, or hopefully just the elected representative, the person who we've elected to be in charge, who listens to a whole variety of top experts and then makes the decision based on all of that. I think as we step away from the pandemic, as it recedes in the months ahead, and we start doing more postmortems on what happened, I think more and more people are going to be looking back at those pandemic guidebooks that were written by the federal government and the provinces that said, this is the way we were supposed to do things. It's kind of a very maddening experience to actually read those documents, as I did recently, because you realize, oh, we weren't really supposed to do it this way. So why did we? I think a lot of people are going to be asking those questions, and they're going to be asking those politicians, why did you just always throw up your hands and say, well, all I'm doing is following exactly what I'm told to do by these health officials?